Hello and welcome to the Roundtable Podcast. My name is Shogun. Joining me today is my good friend Drewish. And Drewish and I will be debating today the topic of physician-assisted suicide, aka medical euthanasia. He will be arguing against it. I will be arguing for it. Before we get started, please join the Roundtable Discord server where we record these podcasts every day at 8 p.m. Central. Check out announcements for upcoming events and find hundreds of great past episodes and #RT podcast. That being said, welcome, Drewish, my friend. How are you today?
I'm doing well.
Awesome. Well, I'm looking forward to this. We're going to jump right into it. Just a reminder, this is part of the Roundtable formal debate series. We will be doing a short form today, so that will be 3 rounds of 5 minutes each. I will be going first, arguing the positive position, which is that this physician-assisted suicide should be legal in some cases. Mr. Hermes will be the moderator. He will indicate the round, when it begins, when the speaker has 1 minute remaining to close their argument, and when their time is up. And a reminder, when your time is up, you must stop, even if you're mid-sentence, please. That being said, let me just step in and sit down, and we'll get started in about 60 seconds.
So 3 rounds. Everything is set. Just let me know when to start.
Yeah, I would just like to take my traditional ceremonial toke, if I can, if I could. I guess not. 1 second. Okay. Whenever you're ready, Hermes, just give me a cue and then I'll get started.
Okay, so this is the beginning of round 1. Shogun, start whenever you're ready.
Thank you very much. So on the topic of physician-assisted suicide, my basic arguments will be in terms of society doing what is most compassionate, but also what is best in terms of social policy. It's a policy issue. So the question is, what is the most effective, responsible, and beneficial social policy to deal with the issue of suicide? So, of course, I'm not going to be arguing that anyone who feels like they want to die should be able to go to a doctor and get a pill or an injection to end their lives, because then, of course, you would imagine many people who are going through a difficult time in their life, anyone from, angsty teenagers to, people going through some kind of temporary depressive episode or sad about a breakup or something, would be ending their lives willy-nilly. However much that would happen, that would not be a desirable outcome. That's obviously not what we're arguing for here. What I'm arguing for is a very limited and specific situations where physician-assisted suicide would be compassionate and not have harmful outcomes and would therefore be desirable. So the most obvious and clear case of this for me would be in the context of palliative care is like the final stage of medical care when it's no longer possible to save a person's life, so you're just caring for them as they inevitably approach death. So then you'd be in what's called a hospice usually, and so you'd be receiving painkillers and maybe sedatives just to try and ease your pain, but they already understand that you are going to die. You're not going to need this hospice care. So the argument here would be that for some of these patients, their quality of life would pass a point in which further prolonging their life serves no meaningful purpose and becomes incompassionate. So if you have cancer and that cancer is causing you extreme pain on a daily basis and it's only worsening day by day, so as it progresses, the pain gets worse and worse, your death gets closer and closer, but through some cruel reason, this process is very slow, and the patient reaches a point where they consciously and explicitly decide that they no longer wish to continue, they no longer have quality of life. Perhaps they've already had a chance to say all their goodbyes and resolve all their affairs, write their will, and make their peace with God. And so now all they want is a dignified and I would say cases what they want is a sense of control, because rather than waiting for death to strike them helplessly, this allows them to make a conscious choice about when and how to die. And that allows them to have their family there, have a priest come and say a prayer, kiss their grandchildren goodbye, and die in a bed with dignity, with a doctor, with their family, and all of this, right? So this is desirable and it is beneficial because it spares them unnecessary additional pain. But much more importantly, I think, or equally importantly, I'd say, it gives more dignity and a sense of control and security to the patient and their family. Because the very fact that a doctor is present and that the process is medical is something that psychologically comforts people. They feel that they're in the control of an expert, that this has all been done before and it's being done in the proper way. And it's not something unethical or illicit. This is socially accepted. This prevents adding to the suffering of the patient and his family as a result of stigmatization, because suicide can be stigmatized. So if somebody doesn't have this option and yet they cannot go on living, they might be forced to commit suicide on their own terms. And this might have many negative outcomes, including that they may botch the attempt because they will not have the adequate knowledge to do so correctly. They may choose a method, like many women swallow Tylenol trying to kill themselves without realizing that this will cause like a horrifically painful and agonizing death through liver failure. It's not just going to put you to sleep. So that kind of horrible outcome would be prevented by going to a doctor who could administer a mix of an opiate and a sedative so that you could painlessly and even euphorically go to sleep. And also, one of the issues with suicide is, you leave a body. And so then your family comes, they're like, where's grandpa? We haven't heard from grandpa. And they go in and they find the corpse. That's very traumatizing, extremely traumatizing. And nobody wants to leave their family with that kind of trauma. So doing it, with the doctor's approval, it's legal. There's no issue with disposing of the body. This creates a much more humane environment. And again, it wouldn't cause any additional deaths or suicides, so to speak, in the sense that this would only be done after a psychological evaluation of the person. They had given written consent and signed it, and a doctor had agreed that they had a terminal illness and were suffering severe pain. And on that, I'll yield my time.
All right, you had like 4 seconds left. That was part 1 of round 1. Now we're gonna go for part 2 of round 1. Drewish, are you ready?
Oh, I'm ready.
Okay. Whenever you're ready, go.
I just posted 3 articles in chat, but I'll summarize them for those who aren't listening live. The first one is entitled, Healthy Pets Sometimes Euthanized for Owner's Convenience, with the opening line, Animal advocates are calling for an end to the euthanization of healthy pets purely for their owner's convenience, a practice Canadian veterinarians acknowledge is an unfortunate fact of their profession. Give it a read when you have a chance. The second article, which is totally unrelated, of course, is a New York Times article entitled, Passive Euthanasia. In hospitals is the norm, doctors say. I'm going to read a small section of this article. The inflection added is mine. He could operate to try and remove the obstruction, but the chances are that it would do no good. Or, Dr. Markman said, you can put a tube in to drain her stomach so she doesn't throw up. But then he added, you have to ask the woman, is that what you really want? She would have to live with that tube for the rest of her life. Dr. Markman, who said he sees such patients at least once a week, tells the woman that he wants to focus on her symptoms rather than her underlying disease. He sends her home with pain medications if she's in pain and anti-nausea drugs if she is nauseated, but the woman will never eat or drink again because of her obstructions. She will not return to the hospital for any sort of aggressive treatment. Dr. Markman said he never bluntly tells the woman that there is no hope and she is going to die, but he, and probably she, know what is going to happen, and soon. For the last article of the 3 it has the title, Dutch doctor who euthanized Alzheimer's patient cleared of criminal charges. I'm just going to read a little bit about the background of the case. The patient was a 74-year-old woman diagnosed with Alzheimer's disease 4 years before her death in 2016. She had seen her mother suffer with that agonizing, incurable condition in a nursing home. Not wanting to go through the same experience herself, she drafted documents, while impaired but still competent, asking that she be euthanized whenever I think the time is right for this, and when the quality of my life has become so poor. Doctors observed her closely until early 2016, at which time, in consultation with the family, the physician in charge concluded that she was suffering unbearably and incurably, and scheduled euthanasia for the morning of April 22, 2016. The problem was that the elderly woman was herself now no longer capable of expressing clear volition. Dutch law requires a patient's request for euthanasia be voluntary and well considered. An advance directive may suffice for patients who cannot make their wishes known, but the doctors who proceed with euthanasia on that basis are supposed to stop if they detect behavior and utterances that may indicate resistance or objection to termination of life. The 104-year-old scientist who chose which day to die, Australian professor David Gual, held a news conference in Switzerland May 9th, the day before he took his own life in assisted suicide. In this case, the doctor spiked the patient's coffee with a sedative for what she later acknowledged was the purpose of preventing a struggle during the euthanasia. When the doctor inserted the needle for a lethal dose, the patient, apparently reacting to pain, tried to stand up. At the doctor's urging, family members then held the woman down so that they could finish the lethal injection. If you think that the medical establishment is here to protect you, that you can trust them, that coercion and medical malpractice are things of the past, that they're just here to assist you, when they're here to assist your suicide, I have a bridge to sell you. This is not what you're being sold. Assisted suicide is not suicide. You can kill yourself. You're completely capable of killing yourself. There are so many means by which to do so. People do it all the time. Assisted suicide is giving the power to institutions and medical professionals to end your life supposedly on your behalf. There's more to get to, but I yield my time.
All right, you had 50 seconds left. That's the end of round one. Shogun, are you ready to begin round two?
Yes, I suppose I am.
I will start whenever you start.
Okay, thank you. So listening to Drew's last turn and reading sort of between the lines, I believe that the point he's trying to make is that this system would be open to abuse, and it could lead to very undesirable outcomes such as, doctors actually essentially murdering patients by not respecting their consent, or, using the pretext of euthanasia to kill people who perhaps have not actually offered the necessary consent. And I would certainly concede that those are very important and real concerns. And so obviously any social policy designed to implement physician-assisted suicide would necessarily have to have extremely strong protections in place to ensure that no such abuses of this nature could occur. And the examples that you gave are certainly disturbing, but I would argue that these are sort of, like you said, these are cases of a system being abused, not necessarily problems with the policy, be problems with implementation, right? Exceptions that prove the rule. Now, obviously, in the case of something where you're terminating life, we can't have even one thing like this happen, right? We can't have any percentage of, murder happening under the pretext of euthanasia. So obviously, I could only endorse such a system under the assumption that it could be rendered essentially immune from such abuse, which I do believe would be quite possible with the correct social policy in place. So again, you'd have to just make sure that, multiple independent expert, investigators in there to talk to the patient, talk to the doctor. Everything was videotaped and recorded and reviewed, and done to the strictest possible standards of ethics and so forth. In which case such abuses should not happen. But I do want to acknowledge that, we would have to proceed with extreme caution and care, use fail-safes and safeguards and reviews to make sure that this was essentially impossible for these kind of abuses to happen. Now, you mentioned that, suicide is something people can do themselves. They do it all the time. There's lots of ways they can do. Well, that's certainly true, right? Suicide is one of the leading causes of death. People kill themselves all the time. Unfortunately, many of those ways are gory and violent, messy or traumatizing, illegal or dangerous in some way to other people. For example, depressed father, girlfriend leaves him, shoots himself in the head. Little toddler child lives in the house too, finds his dad that way. Child is fucked up for life. And then of course you have, as I said earlier, the people fail suicide all the time. Actually, I think, more than half of suicides are failed attempts. And so people, cut their wrists in the bathtub and bleed and bleed and bleed, and they don't die. They go through horrible trauma as a result of this, and they're unsuccessful. Or as I said, they they impulsively take the wrong chemicals or the wrong drugs, and you have some horrific death from poisoning or end up with brain damage and blind, but you're not even dead. So these are all the kinds of horrible outcomes that happen when we trust people to, quote unquote, just administer their own, simple suicide. In other words, it's not actually as simple and easy as you might imagine. And botched ones are more common than you'd imagine. So suicide should obviously be extremely rare and only in these desperate situations. But when it is going to be done, it's better essentially for it to be successful than unsuccessful. And so that's where a doctor and his expertise comes in. And, the reality is that you are a very intelligent person, Drew. But as you know, the actual intelligence and competence of people varies greatly. Not everyone is so smart, and things that seem like common sense to us are just simply not known by people, right? So they do horrible things to themselves, thinking this is going to be like a painless death. And so there's all that involved, as well as, let me just think of what I was going to say. Right. So, the only real my point is this is more benevolent, it's more compassionate, it's safer, it removes the stigma. And when I say safer for, other people, right? The families and so forth, as obviously suicide cannot be safe. But the only sort of counterpoint I'm aware of so far is the potential for abuse. So then I would argue, okay, there's all these desirable outcomes that we want to achieve from euthanasia. And there's also negative outcomes we want to avoid. That's sort of the case. Any social policy. So I would say we do this carefully. We do it with strict controls and protocols of review, but we do indeed do it. And then we achieve the benefits while avoiding the legitimate concerns that you've raised. And I'll yield my time.
All right, you had 3 seconds left. And now we're going to go to part 2 of round 2. Drewish, are you ready?
Sure I am.
Okay, then I'll start whenever you start.
You're talking like stigmatizing suicide is a bad thing. It's a good thing. There are honor cultures where suicide isn't stigmatized. In fact, it's sometimes encouraged. And yeah, the rates of suicide there are higher. Go figure. If your goal is to actually reduce people committing suicide, which seems like something you want to do, you don't like the fact that people kill themselves in desperation when they don't know that there's help out there for them, yes, then making suicide something people feel repulsed by, feel guilty about, worry about the people they'll leave behind. Yes, that's a good thing. We don't want suicide to not have a stigma behind it, because we want those people to seek help rather than killing themselves. Like, I don't know why that seems like a good thing in your mind, that we should remove that stigma. And you were comparing an ideal to a practical. All the cases that I listed are real. And I just posted 2 more things. One about, Brazil is someone who's just from this week, like no underlying health risks. 13% of people who take advantage of assisted suicide, nothing physically wrong with them. Okay. But, maybe they have some mental issues, but counseling, the whole point is to try and help these people, but we're giving them an out and say, yeah, you can kill yourself. That's a conceivable out, and we don't want to discourage that as an option. Instead of giving these people the help they need. And the other article I just posted was about a woman in her 20s who was sexually abused and given assisted suicide as a way out. Like, what is this doing? This is compassion. This is compassion saying we're not going to help you. We're just, hey, yeah, we're going to help you. We're going to help you kill yourself. Okay. Except you're not actually killing yourself. Someone's doing it for you. Okay. Because so I know that it's being sold as compassion, but I don't believe it. A lot of things are sold as being compassionate. And then what's the end result here? What's the end result? Is it giving people any special rights that they didn't have before? I can kill myself. You know what? If I kill myself and I fail, I don't go to jail for that. I could be committed to a mental institution, but you know what? I could be committed to a mental institution right now by a physician for no reason. The same physicians that you would then want to give the power to kill me legally. Like, I mean, yeah, some people aren't as smart as other people. Some people aren't as wise as other people. But I think people should have the right to decide these things for themselves, only for themselves, and that means no coercion. That means nobody else pulling the trigger. Some people might want suicide to be more comfortable. And you know what? That's fine. The fact that like opioids and all these other medications that we give to people, okay, when they're committing suicide, they can't get on their own. If you want to make suicide kits, if you want Dr. Friendly's kitchen home suicide kit, make it available by prescription or not, that's fine. Give people the power and means to take their own life if they want, but they've got to do it themselves. They've got to be the one to do it themselves, because you cannot prevent abuse otherwise. There's no way to prevent it. And you can sell this compassion all you want, but I think the stigmatization of suicide is a good thing. I think wanting people to seek help first rather than thinking that there's a way out that way. I don't want people to take that way. I can name, a cousin of mine, a good friend of mine. I've known people who've taken their own lives. This is not something we want to encourage. This isn't a good thing. And people who are at the end of life care, we say, oh, well, these people, I just read you an article where the doctor was saying, well, does she really want to live the rest of her life with this tube in her stomach? I'm just going to have her treat her symptoms, sending her home, not telling her that was basically a death sentence and assuming that she knew that. Like, he admitted that he was basically doing that in the article, that he was basically making that decision for her, because he didn't bluntly tell her, if you go this path, you're never going to eat again, you're going to die. And these physicians are making these decisions thinking they're being compassionate, thinking that they have the right to decide for other people because they don't respect their autonomy. This is not improving people's autonomy. It is not giving people greater rights over their own life. It is taking it away, allowing doctors to play God and killing us while thinking they're doing us a favor by doing it. I yield my time.
All right. You had 30 seconds left. And that concludes the end of round 2. We're going to begin round 3. Shogun, are you ready?
Yes, but just before I begin, it's just occurring to me that I think we should have made this a long form. I don't think we've really had a chance to hash this out fully, so I'd just like to submit to Drew that we extend this to 5 rounds. It's up to you, but that will be my proposal. If you want, you can think about that while I take my 3rd turn, and then let me know if you want to do another 2. But I feel like we haven't really got as far through this as I had imagined we might have.
I'll meet you halfway. I'll let you have the next one, then I'll deliver my last one, and then I'll let you have the last word, including
it has to be a number of rounds. It's either going to be 3 or 5, and we're going to have the same number. So okay. you can either do 3 and make that the end and then go to open discussion, or if you're up for it, we could do an additional 1 or 2 rounds, and I'll leave that choice to you.
Okay, well, whenever you're ready to start, I will start the beginning of round 3.
Okay, so I want to say that at this point, it sounds like what's happening here is, you're looking at abuses of in systems and of systems that exist in the world, but that's actually really is not relevant. Because I'm not arguing that any existing system is something I endorse. I'm proposing the social policies that I would create given the freedom to do so. So the kind of things you're pointing out are, actually irrelevant in the context of what I'm actually proposing. Right? I would in no way disagree that those are totally unethical things that you're describing. So let's go back to what I'm actually proposing. I'm proposing that people with incurable diseases, right? People who are dying from incurable diseases with no hope of recovery, and who are suffering extreme and unendurable pain, and are consciously giving informed consent and making a sovereign choice for themselves without coercion, with full informed consent that this is what they want to do after going through extensive psychological, screening and testing, and after using therapy and counseling and medication and other options, right? Only in such a case would this medically assisted euthanasia be taking place. So no, it would have nothing to do with coercing people. It would be the opposite. There would be no coercion. It would have nothing to do with deceiving, misleading, or misinforming people. On the contrary, right? These people would absolutely know their diagnosis, their prognosis, that they were choosing or not choosing, and everything. It would all be fully conformed. So when you say, oh, well, he, let her die with, of course, that's what we're talking about whatsoever. We're not talking about physicians killing or misinforming them or anything. We're talking about when, God forbid, you reach that point in your life where everything is pain and it's only going to get worse and it's not going to get better, do you have a sovereign choice in consultation with your doctors and therapists and lawyers, right, on camera with witnesses signing, etc.? All of this protects from abuse. There's no just some baffled old senior getting a pillow put over her head by a doctor. That's not what we're talking about. We're talking about conscious decisions made with family after therapy, medication, and everything else has been tried, only in this extreme situations, with multiple safeguards, like everything being recorded, multiple witnesses from governments, and on and on and on, everything above board. That's what we're talking about. Now, you said we don't want to encourage suicide. Of course not. And this isn't encouraging suicide, right? This is like admitting that in some cases it's a necessary or unfortunate lesser of two evils, right? Now, you said, well, suicide should be stigmatized. And in a sense, I agree, right? Like the kinds of suicides that are legitimately stigmatized are precisely the kinds that would be excluded from this physician-assisted suicide. So it's exactly like I said, right? A father at home can't handle his problems, so he blows his head off in the bathroom, lets his 5-year-old son toddle up and see him, and ruins his life. That's a horrible, shameful thing, right? And although that person might have been very mentally ill, there's a reason that that kind of action is stigmatized, right? And would remain stigmatized, but precisely by offering this legitimate above-board alternative, which is an exception to that rule. So the suicide that's stigmatized are those that occur outside of this context. But in this context, should suicide be stigmatized? Of course not. If you have, third-degree burns covering your entire body, you're 95 years old, your entire life is pain, and you have no chance of recovery, why would you be stigmatized for choosing to end your life, right? Because you have to understand also that stigma doesn't just affect the person, it also affects their family, right? If in your culture this is dishonorable and shameful, that is left with the family. That just adds to their burden. As if this is understood that, yeah, this was a totally legitimate medically assisted suicide. There's no stigma, there's no shame. It's just a medical procedure essentially designed to treat extreme pain, right? Or to maximize quality of life as calculated, positives against negatives. There should be no stigma to that, right? So this is all about realizing that out of all suicides, right, most should not be happening, but in a very small number of very carefully screened situations, this is a compassionate thing that doesn't harm anybody, doesn't encourage suicide. And I specifically started by saying this would not be, some heartbroken person whose wife died, or someone who was going through gender dysphoria, or somebody who was in debt, right? This would be for this extremely limited case. And it is more compassionate, would not result in an increase in suicides, and all of the abuses that you pointed out could be protected against through well-constructed policies and safeguards. I'll yield my time.
All right, you had exactly 1 second left, and now we're going to go into part 2 of round 3.
Before I start, I would like to say I'm totally fine with extending this to 5 rounds if you would like.
Okay, well, we can continue. So whenever you're ready, just start, and I'll start recording time.
Sure. I'll get a little personal here. So Alzheimer's runs in my family on both sides. And if I get diagnosed with Alzheimer's, I'm going to have to go off into the woods, and I'll never come back. I'll make it happen. Now, there are ways that I could make that more comforting. I could essentially OD on an opioid or something like that. Oh, wait, I can't do that legally because the medications which would enable people to commit suicide in this painless way are denied them legally, but made unless they go through the medical establishment. And so the means by which people could have, this easy, around family, a suicide that wouldn't be this violent, graphic things are explicitly denied them unless they go through a means by which the medical establishment administers it to them. Like, that's pretty messed up, because it means that the biggest argument for the medical establishment being there to assist you in your suicide is just because they're saying you can't be trusted with the means to commit suicide in a painless way. I think that's pretty screwed up. And yes, I understand. I'm sure your system, the one you're proposing, would not have the same unintended consequences if designed differently. And I don't think that people in the Netherlands, when they put forward their system, had any intention of the abuses which are occurring there and well documented to be the end result. They're called unintended consequences for a reason. I don't need anybody else to take my life. And I know that if I have to make that choice someday, it's not going to be an easy choice. And maybe I won't be able to do it. Maybe even knowing that I'll be putting my family through the burden of taking care of me, um, with all the financial and the emotional toil and knowing exactly what that looks like because I've seen it in my own family. Maybe I won't have the strength to do it. But that choice needs to fall on my shoulders. If I have the agency to control my own life and to own my own life, then I also have the responsibility to directly apply that agency in ending my own life. Because if I take the coward's way out, and I mean the real cowards, I mean suicide in a lot of senses is already the coward's way out. But the real coward's way out of like, oh, I'm going to kill myself, but I can't actually bear to do it myself. What am I going to do? I'm going to be so selfish that I'll commit suicide, but not actually be able to really commit suicide. Have to have someone else do it, and then empower a medical establishment to do that, knowing the kind of infringements that can occur by doing that. I'm not going to do that to my daughter. I'm not going to do that to my grandkids if I have it. I won't do that to future generations. Be that selfish because I can't face my own mortality like a man. And I don't mean that to be sexist, but I mean, I can only speak as a man because I am one. I really would like to hear more about the particulars from you, Shogun, about the kind of situation you're set up, because it sounds to me like the system you're proposing is one where, oh no, Andrew has bought, my name is Andrew, has bought enough things that he could conceivably kill himself. He signed a DNR. He's a suicide risk. Let's lock him up to prevent suicide by the very medical establishment says, you're not allowed to commit suicide. We're doing this to protect you. Unless, of course, you want to commit suicide by the official channels. That's the kind of world that I'm envisioning coming about with the system you're proposing. I know people are going to kill themselves. I know it's horrible. But what you're proposing here won't solve any problem. Like, it's not a problem that actually exists. Who are these people who want to die but yet are unable to take their own lives? So I really want to hear more about the specifics of the plan that you're specifically proposing, because if I'm by responding only to what's actually been implemented in the world and missing the plot, I need to know what it is. I yield my time.
All right. You had 35 seconds left, approximately. And that ends round 3. Since we're going to be doing round 4, Shogun, are you ready?
Yes, sorry about the background noise, and thank you, Drew, for agreeing to do more. I feel that will be productive and worthwhile to get into it a bit deeper. So without further ado, I want to address a few points that you brought up. So one of your disagreements here, to me, seems like sort of emotional and identity-based. This is just my interpretation, in the sense that you find something very distasteful about someone not being able to, quote-unquote, be a man or be a woman and do it themselves, and you don't like that. You feel that they should be able to kill themselves. That's fine as far as it goes, but I'd argue that this is a somewhat symbolic and arbitrary distinction. So if I throw myself off the top of a building, no one would contest that I killed myself, right? I was a man. I did it, right? So to speak. Not that killing yourself makes you a man, but according to your standard, that was like a real suicide. But if a doctor puts a needle in my arm and I die, even though I asked for it, signed a consent, signed a waiver, asked him to do it, then now I have not done it. Now, I'm sure you can see this is really just an arbitrary distinction. So let me give you another example. Instead of coming in and putting a needle in your arm, all the doctor did was go to the pharmacy and compose the suicide pill, right? So he puts in the sedatives, he puts in the opiates, he says, this is strong enough to kill you, I guarantee it, it's going to be painless. Then he hands it to you and gives you a glass of water and says, if you're sure, right, after you've already signed all your papers and gone through all your screenings, just take that pill and you'll die. So then you take the pill, you wash it down. Well, now the sovereignty has been restored to you again, right? You weren't killed by the doctor. All the doctor did was provide you with the drugs, which you already said, from your last turn, you should be able to have these drugs. Now, you can see now, okay, so if the doctor puts a needle in your arm at your request, you have cowardly refused to do it yourself. But if he gives you a pill and you swallow it, or gives you the needle and you inject yourself, now you've bravely owned your destiny. This is just, it doesn't add up, right? The point is, it's a suicide either way. It's your own choice either way. And if you are an old person with shaky hands and, arthritis, you might miss the vein and screw up the shot. So in order to make sure that it goes safely, you're going to want a doctor to help you out with it. And that makes perfect sense. And so there's that. Now, secondarily, you were talking about, how absurd it is that, the very same psychiatric profession that tries to prevent you from committing suicide would also then administer euthanasia. But I would argue, no, this is precisely the reason of the system, right? So if I am a father one day, and God forbid my, 14, 15-year-old daughter, his boyfriend broke up with her at school, and the kids at school teased her, so she thinks she needs to kill herself, and she's going to try and slit her wrist open with a razor blade, and I come in and see this, or a nurse or doctor or teacher comes in and sees this, absolutely they should grab her. Absolutely they should put her in a psych ward or give her the appropriate therapy and make sure she doesn't tragically end her life when she has so much ahead of her and she was just acting out on an emotional impulse that she didn't understand or couldn't control. That is a legitimate case for us to stop that suicide. Does that mean it's then illogical to medically assist a 90-year-old person who's in continuous pain with leukemia and brain cancer just to give them that self-same sleeping pill and let them take it themselves so they can die? No, these are not contradictory. There's no illogic here because the circumstances are totally different. So whenever there is quality of life to be preserved, whenever there is quality of life to be had, our goal is to preserve and save that quality of life. Whenever the mind and body can be healed and restored, our goal is to do so. The very existence of medically assisted euthanasia is to recognize that despite all our best efforts, even when we make every therapy available, even when we do everything we can, some people will still have no quality of life and will still want to die. And if we deny them that last and only control they have over their destiny, right? They can't cure themselves of their disease. They can't make their pain stop. They can't recover. The only choice that remains to them is to die. And if you deprive them of that choice, you trap them in a living hell where they don't even get the only comfort remaining to them, which is dignity, choice, and control. And again, it doesn't matter to me. Give them the pill, right? The doctor just formulates the pill and then they have to take it themselves. That deals away with the concern of them just like shooting up old people, whatever, right? So that's where, if that's an issue for you, I just say, well, let's just make it a pill. The doctor composes it to your needs. You take it on camera after all your therapy and counseling is completed. Sorry about the background noise. So that's where I'd put that. And sorry. Essentially, I think, I'm trying to think if there's anything else I can wrap up in this point.
20 seconds.
Yeah, so let the doctor compose the pill, let it be applied only in desperate circumstances, only under the strictest of safeguards, only after counseling and therapy have been tried, and only after quality of life is irretrievably lost. And I'll yield my time.
All right, you're at 3 seconds left, and we're going to go to part 2 of round 4. Are you ready, Drewish?
Sure.
Okay, I'll start whenever you start.
Let's take suicide by cop, which is, again, is not real suicide, but we call it such. Yeah, that is a cowardly act. You're putting your death on the conscience of the officer who ends up having to shoot you because you forced him in that situation. I'd say the same would be true for the doctors, except they apparently don't have any remorse and, in fact, tell themselves or think that they're helping you when they kill you. Okay? So, because that difference between you taking the pill and the doctor injecting you is crucial. That line right there is what prevents abuses by ensuring that ultimately it's the individual who's empowered to take control over their own life. And it sounds to me like I've convinced you. It sounds to me like you're saying that, okay, assisted suicide in the sense that someone else is killing you, don't do that. Suicide, where we allow people the means by which they can take their own life if they so choose. And, it's by prescription, so on and so forth. You got to get all through all this stuff to get the suicide pill. Okay. If you're conceding that point, I got no beef, because at that point, it's not assisted suicide anymore. At that point, it's saying, if you want to kill yourself, we might make it easier for you to kill yourself. We can have a room. You can have the pill. You've got to take it yourself. No one else is allowed to give it to you, but you ultimately have to be the one to kill yourself. It has to be real suicide. I'm totally cool with that. And that means that won't be any assisted suicide as far as I'm concerned. It'll be real suicide. So if you're really agreeing to that, I mean, I personally take it as a concession, but by all means, that no need for further debate. I concede my time.
Okay. You had 3 minutes and 20 seconds left.
I would encourage you to perhaps consider using more of your time. Was that his last round? No, he has another. So again, like the idea is to, if you really want to, you can, but we're highly discouraged yielding more than half of your time, so you can make more arguments and maybe perhaps buttress your position further.
Okay, all right. I will just say what I asked for were specific details for your proposed situation that would not allow for these abuses of assisted suicide that occur in the real world situations where assisted suicide has been enabled. I have been arguing that suicide and assisted suicide, the difference and distinction consistently throughout is whether you're doing it to yourself or someone else is doing it and empowered to do it on your behalf. And that is a red line, and that cannot happen, because if you do that, these sort of abuses cannot be avoided. And it sounds to me like the system that you are proposing is now incorporating that red line into it so that I wouldn't even consider it assisted suicide anymore. And if that's the case, cool. No, I have no problem with that. It's just that at that point, you're basically, from my perspective, agreeing that, while we might disagree about the stigmatization of suicide and so on and so forth, you're agreeing that assisted suicide, where someone else is actually administering the means by which you kill yourself with quotes, doesn't occur, then cool. At that point, I can only treat it as concession, as if you're agreeing with me. If I'm wrong, and there's nothing wrong with admitting if I've changed your mind. That's one of the best things that can come out of a debate. But I don't know what I debate against if it seems to me like I've changed your mind and you now agree with me. So that's why I'm conceding my time.
Okay, you had approximately, I think, 1 minute and 40 seconds left. So we're gonna begin round 5. Shogun, are you ready?
Yes. So this is my last round. I'm going to try and fit everything I want to into it.
Yes.
So first of all, I used the example of the pill versus the injection to allow you to consider how actually arbitrary the distinction that you were drawing and putting such emotional impulse in, right? Be a man and end your own life. Don't be a coward and let a doctor do it. But the only difference is, does he hand you a pill or does he put it in your mouth after you've agreed? And if we're actually looking at it, it's not whether you physically put your hand on something or whatever that makes you do it. What makes you do it is your consent, your choice, your action. And that action doesn't have to be the action of putting the pill in your mouth. That action can be the action of signing a paper and saying, I want the doctor to put a pill in my mouth. There's no meaningful difference between the fact that one action is putting the pill in your mouth and the other is initiating consciously through a physical action the process that leads to the pill being put in your mouth. So this is like it's an arbitrary kind of line, and the point I was making was show that. Now, I would still say that for the purposes of dignity and autonomy, like, you want to give these people the maximum feeling of control and actual control. So I would like that idea where you make the pill and you give it to them. But again, that would only be ideal. There would be cases where that was impossible, right? So the problem with what you're doing, I find, is you're saying, well, who are these people who can't kill themselves? Well, a lot of people, right? And the people in this kind of fucked up situation, they could have such bad cerebral palsy or multiple sclerosis where their hands shake so badly, they're not capable of putting a pill in their mouth. Or, they could have burned so badly that all of their arms and legs burned off and they have no arms and legs. So if your attitude is, well, if they can't end their own lives, they should have to live with their pain. All you're actually doing then is further disadvantaging the most unlucky, because ultimately even the physical and mental ability to kill yourself is a kind of a privilege of the healthy. And it's precisely the most unhealthy who will be unable to do so, and precisely them who will need it the most. So just imagine this, right? God forbid, you're in a plane crash. You wake up, you have no arms, no legs, no skin, right? Your whole body has been burned off. You have no eyelids, right? No lips. You're just a sneering, truncated person in continuous pain, all right? And then they're going to say, well, here's your pill, sir. Go ahead and take it, right? It would be like a surreal Kafkaesque joke, right? So in that, person has to be able to initiate their suicide in a way that doesn't involve the physical use of their hands. So this is not a concession. It's an attempt to allow the somewhat facetious nature of the distinction being made. And you're saying, well, in that case, it wouldn't be physician-assisted suicide. It would just be suicide. But no, because listen to it, physician-assisted suicide. So in either case, it's still you committing suicide. That's not the point. This is kind of the false pretense of your whole argument, to be honest, was that physician-assisted suicide is not suicide but murder. That's not the case, right? The patient is committing suicide. It is the patient's choices and actions that lead to the termination of their life. There is no coercion. The doctor simply provides whatever literal assistance is necessary to accommodate whatever disability prevents the patient from doing this on their own, or just even to oversee the patient's suicide plan, right? The patient could even decide how they're going to commit suicide, perhaps. I wouldn't favor this, right? But the doctor just reviews the plan and makes sure it's going to work and make sure everything's done properly. The point is, when the physician gives that pill that he's mixed in the pharmacy that's going to kill the patient, he has now assisted. He has given his assistance. The physician has assisted the suicide by preparing the pill. The patient takes the pill, he dies. This is absolutely physician-assisted suicide. So it's not a concession. And it doesn't rectify our positions, because all I'm saying is this is better, because the other alternative is then he has to find a pill on the street. So he goes to a drug dealer and he says, I want to die, give me fentanyl. And the guy says, oh yeah, this is going to kill you for sure. And the guy takes it and he wakes up and he's had a stroke and a coma and he's been given 3 shots of Narcan by an EMT. And now he's got fucking no brain activity and he's worse off than before, but he's not dead, right? Not no brain activity, he's got brain damage, right? So this is about harm reduction. It's about recognizing that suicide is going to happen either way, and that in some situations, certainly the minority, suicide is not necessarily something we actually want to stop or dissuade. We always want to stop or dissuade suicide in all possible cases, but there's always going to be that outlier where even the physician will say, yes, in this case, it's compassionate to, allow this person to drift off to sleep because they were only going to live for another week anyway, but it was going to be a living hell. So I would just argue that this position will not cause additional harm. It will be compassionate. It will reduce suffering. It will maximize quality of life. And I would argue it would probably actually decrease suicides overall because it allows it to happen only when necessary and could even be paired with further efforts to stigmatize it otherwise. Thank you.
All right. That was basically on time. And Drewish, are you ready for part 2 of round 5?
Sure am.
All right. I'll start whenever you start.
In the case I mentioned back in round 1 from the Netherlands, the person was trying to stand up when being injected. The law specifically stated that your preordained consent doesn't matter if in the moment you resist or protest, because they knew, and I think you know too, Shogun, that actions do mean more than a signature. But despite all that, the doctor was found not guilty. The system will make sounds and words that these policies are all about enhancing your autonomy and rights. Don't believe it. Back in August of 2019, Jeffrey Epstein showed us all what assisted suicide's future is. Power has no respect for your life or your rights. Do you need a law to enable you to kill yourself? I don't. If I wanted to off myself, I could. It's not that hard. People do it by mistake every day. Just check out some Chinese live leak videos. Assisted suicide is, in fact, not suicide. It's giving medical institutions the power to legally kill you, supposedly on your behalf. They frame this expansion power to kill innocent people legally as a battle for personal freedom because that's the way all your rights are always being taken away, by framing them as giving you more. You're not losing your bodily autonomy by allowing the same professionals who can forcibly lock you up, for your own protection, of course, to then also have the means to legally kill you. No. This is about compassion. It's about your right to end your own life by having somebody else inject you with a legal dose of opioids, which of course you aren't allowed to legally access yourself. Again, you want to sell Dr. Friendly's Kitchen Kill Yourself kit, available by prescription only, fine. I don't care if people are given the means to end their own life. It's not like we can really stop suicide anyways. But the moment somebody else is wielding the knife administering the shot, or pulling the trigger, it ain't suicide anymore. I own my life. I have agency over my life. If I seek to end my own life, then I should have direct agency over the act. And if there are people who sincerely want to end their own life, but can't bear to pull that trigger, then good. Fewer people killing themselves. Giving physicians the power to kill because some people want suicide to be easy, painless, and socially acceptable? Hell no. We do that, and we'll solve the issue of taking care of the elderly. We'll solve those problems real fast with a smile and a pill and a whole lot of assisted suicide. I yield my time.
All right. Well, you had 2 minutes and 30 seconds left, and that was the end of round 5, which is the last round, from my understanding. So we're going to be opening up to questions, I believe. All right.
That's correct. And thank you so much to my interlocutor, Drew. I really enjoyed that. Thank you to Hermes for the excellent moderation. I was wondering, can anyone do us a final favor and create the traditional 3 straw polls? So these will be 3 polls in general chat, or preferably in general chat, I suppose, or podcast text if you prefer. But again, traditionally we ask 3 questions. The first one is, which of the 2 debaters do you feel did a better job at debating, regardless of who you agreed with? It'll be either Drew or Shogun. And you can either vote or just see the results if you don't want to vote, but please vote if you did hear the whole podcast, the whole debate. The second question is, which of the 2 opinions do you agree with, regardless of how well the person argued? Which of our options do you agree with? Do you agree that there should be some form of assisted suicide, such as myself, or do you agree there should not be, such as Drew? That's the second question. Who do you agree with? And the third question ideally will be, did listening to this debate change your mind? In other words, did you find yourself changing your position as a result of hearing these debates? Is there anyone capable of creating these polls for us? I don't actually know how.
I mean, I can do it. Just give me like a minute or 2. But in the meantime, I think
Thank
we should
you.
be addressing the
So,
questions.
yeah, thank you. So everybody who
refrain from voting. Like, I don't think it's fair if we vote.
everybody who heard the whole debate, please do vote on those when you see them. But again, there is no winner or loser. The votes do not determine a winner or loser. They're just for our, analysis of interest. So that being said, is there anyone in the audience who had a question or a comment for Drew or for myself, or who just wants to weigh in on this? And I'm sorry I keep saying Drew. I know it's Drewish.
I dropped that my real name was Andrew in the middle of the debate. If people call me Drew, Drewish, or Andrew, I don't mind. Just don't call me Andy.
Yeah, thank you. So Drewish is the member, and we do have another member named Drew. So regardless, does anyone have a comment or a question about the subject? If not, we can, you and I can discuss further, or whatever you guys want. But again, I enjoyed that.
Yeah, I mean, I went in expecting a 3-round, and we made it a 5-round. So I'm kind of like, I don't know that I have anything more to say.
Yeah, no, I thought it was great that we did a 5-rounder. I think that allowed us to deal with the problem in a much more satisfactorily complete way. But since no one else is taking that opportunity, I want to kind of challenge you on something that you've kind of not answered here so far. So your attitude here is like, if I can't bring myself to pull the trigger, the metaphorical trigger to kill myself, well then, good, that should mean that I don't die or whatever, right? And I would sort of agree with that, because if you're not able to pull that trigger, it implies that some part of you actually still wants to live, and you're not actually ready to die because you're not actually ready to press the button, push the plunger, or pull the trigger. Don't have a problem with that, but the problem you evaded is, what if you're just physically unable, right? What if you would just give anything in the world to be able to get a pistol in your hand and pull the trigger and blow your brains out, and you would do so without a second thought, but you don't have any arms, right? So you haven't accounted for these people who may be 100% psychologically ready, willing, and desperate to end their lives, but due to the nature of their injury or illness are physically unable to do so, because this is basically the pure case of why physician-assisted suicide is necessary. You keep I think you're really putting yourself into the situation and thinking about yourself, but you need to remember some of these people might be completely paralyzed below the neck, right? The very kinds of situations that would cause someone to be this desperate to die are the very kinds of situations where you go, well, who are they? It's not that hard. They can't do it. But you got to remember, some people can't get off a toilet. Some people can't stand up, right? So again, I feel like you're reading your perspective as like a fairly healthy, fairly young person into the situation of people who would not be in the same situation and who would literally require the assistance. Because again, the other thing I want to point out is you often said, well, why not just kill yourself? Well, the point is also this option doesn't take that option away, right? So for anybody who wants to just, as you say, go into the woods and take opiates and die or jump off a bridge or kill themselves in any way, they can still do that, right? This isn't a one or the other.
Hold on.
I just want to say the point here is that this option is precisely for those who, for some other medical reason or whatever, cannot do it themselves. And I feel like that's the most uncompassionate part of your argument, because you're admitting that in some cases people should be able to kill themselves or would want to kill themselves, and that in some cases they do have the wherewithal and the physical health to do so. That's like a privilege, right? Those people have the right to kill themselves. So by recognizing that, you kind of recognize that these other people should have the same right, but simply don't because of their physical incapacities. So then you're saying, well, yeah, if I was young, healthy Drewish and I wanted to kill myself, I could. I'm almost done. But you're like, if I'm young, healthy Jewish, I could kill myself. So you then have a luxury almost that they don't have. And you're trying to deny it to the people who need it the most, essentially.
Okay. Refute that in two easy ways. One, no, I don't have access to the same opiates. In fact, I made that point numerous times during the debate. A lot of the medications which would be used or are used in assisted suicide are not made available to people. And to your other point about the people who really want to commit suicide, but they're just physically incapable, of course, if they're full on vegetable, they can't give consent in any meaningful way at all. Like there wouldn't be any way to know that they want to kill themselves in that kind of a situation. But there is this thing called a DNR. And the number of people who can just not be, resuscitated because they're already on life support, that's huge. And so I'm trying to imagine the situation where there's somebody who is a quadriplegic, okay, but is still like incapable of even, chewing up and swallowing a pill on their own kind of thing. Like, you say you want to commit suicide. Okay, well, here's the suicide juice tube. Okay, just put your lips around it and suck if you want to commit suicide, but you got to do it yourself. Okay, if not, we're just going to wheel you away, even though you've said you want to do it. Anybody who is capable of giving consent in any meaningful way has a means by which they could kill themselves. It's not like we can't be creative. It's like you have one-off situations. Okay, well, you can still provide a means. If they are physically incapable of even controlling their mouth to the extent that they can't say, I want to kill myself, then sorry, they can't give consent to wanting to kill themselves. So we shouldn't consider assisted suicide. So no, I'm not leaving anybody out in that situation. And no, that's just not true. That's not a fair framing of anything I said.
Okay, but again, I think now there's some confusion almost coming in of what even physician-assisted suicide is. So again, the point is I've been defending physician-assisted suicide, and I feel like in your mind that means the physician has to put the needle in, and that's not the case, right? As long as the physician oversees and assists with, even if it's only giving, instructions or advice, like now put the needle in your arm, you want to insert it right here, here's the needle, he hands you the needle, he preps the spot, whatever, right? That's still physician-assisted suicide. So if the, argument that you've been having in your mind is only, someone sticking a needle into an old person and killing them, that's not the definition, right? As long as it's under a medical context, whether the patient takes the pill or the doctor puts the pill in their mouth, whether the patient injects the needle, the nurse does, or the doctor does, it's all still going to be physician-assisted suicide. The point of physician-assisted suicide is the medical context. It's legal. It's taking place in a hospital. There's a doctor present. Consent has been given. And this is all taking place in a medical context. So again, what I'm pointing out is the needle going in one way or the other, it actually is not relevant to our debate, because either way, it's still physician-assisted suicide. And also, I was not talking about vegetables, right? I didn't say anything about people who can't give consent. We've already established for this to happen, it has to be informed consent. The point is someone could have no arms and no legs and yet have their complete mental faculties. And they could say, I would like to die, please, but I can't get up off this bed. Can you please put a pill in my mouth? I don't have any hands to put it in my mouth. So you can't really realistically make this your hill to die on, that if I have a hand and I can put a pill in my mouth, cool, that's fine. But if I have no hands, too bad, so sad, you're not allowed to die. Right. And if you're just about say so the point is, yeah, they can have to press the button. They can have to put the pill in their mouth. It's still physician assisted suicide. And the point is, you still also have the option of non-physician assisted suicide. So if I decide, say I'm 80 years old and I have cancer and I'm going to die, I can do one of two things. I can jump off the top of a cliff, or I can go to a hospital and ask a doctor to give me a shot of morphine, or he can give me a pill. The point is, either way I've committed suicide. Either way it was my choice. In neither case was I murdered or coerced. The only difference is, was I more comfortable doing it with a doctor? Did that make me feel better? Was that better for my family, who could then be there, right? And where they didn't have to do some investigation and figure this out. So this is basically what it all comes down to. The doctor provides a sense of security, stability, medical advice, legality, and social acceptance in the cases where it's approved. But there, you really can't frame this as old people being executed or killed by doctors, because by definition, that would then be murder and not physician-assisted suicide.
That is not the definition you've now just given of assisted suicide is not the colloquial definition. It is not the legal definition. And I was consistent throughout the entire debate about where I considered a suicide and assisted suicide, and made that distinction throughout. It's fine if you want to reframe things now, Shogun. That's cool, but that wasn't the debate we had. And it's okay to admit that I convinced you. Like, there's nothing wrong with admitting that. Like, it's cool, man. That just means it was a good debate.
Yeah, no, I agree. There's nothing wrong with admitting that someone convinced me. And actually, me and Hermes had a debate just the other day about transgender issues, and I concluded that debate by saying, having had this debate, I actually feel that Hermes won the debate, and that he had both the stronger argument and the stronger evidence. And were that the case here, I would say the same. On the contrary, I do not feel that way in this case. Right? I maintain my initial position. And I feel I've exposed some of the issues with yours. But again, that's all in the context of respect, and it's up to the audience to decide what they think. But no, you haven't convinced me, because my position is, if someone wants to access a doctor and have that doctor assist their suicide, they should be able to do so as long as they pass the necessary criteria. I believe that, in fact, quite a bit more strongly now. So that's just the reality of it. Now, you're saying that what I was using is not
Please don't do that.
Well, to be honest, just 1 second. So, I mean, it's right there, physician-assisted suicide. So if the physician assists the suicide, that is the colloquial definition. The physician, there's no part of that term that implies that a doctor has to put a needle in your arm,
Should we open it up? Because I think that was 7 rounds, 2 more unofficial rounds.
Yeah. Nobody else was talking. We were just continuing. But yeah, did you post the polls already?
Yes, I did, and I pinged you. It's in
general. Great, and it's in general chat. Okay, so why don't we stop our debate now, and you can retort or give another comment if you want, by all means. Let's just go ahead and check the polls. See, again, there are no winners and losers. The debate is the vote doesn't determine anything. It's just to show people's opinions. So who did the debate? I'm going to vote myself. I'm just going to click on results. Okay.
So yeah, just definitely check the polls and cast the vote and everything. I have one question, if you don't mind, and it's going to be addressed towards Drewish. And the question is this: personally, and this is just personal from my perspective, if I ever got brain dead, I would want to be killed. I would never, ever want to live brain dead, in diapers with my family, taking care of me, my dignity going to shit all, and just that horrible pressure that I'll put on them, the trauma I'll put on them. I would personally prefer to have some sort of, death through other people's basically inference of what my will would have been. Of course, I wouldn't want a medical establishment necessarily to do that, maybe friends and family or something. But if I'm brain dead, I think that's a fate worse than death. What's your take on that?
So what you're asking about is not necessarily physician-assisted suicide, but if someone could give the rights to end life to another third party in the same way that you have you have someone who can basically take over your estate, if you are considered mentally incompetent or things like that, you have a designated, I forget what there's a legal term for it. I know what you're referring to, but apply that to also the ability to pull the plug. Well, more than pull the plug, because as it stands, if you're already, if you're being kept alive artificially, your family are the right to do that, to pull the plug. But you're saying to go further and have someone else be given the right to essentially declare you should be killed.
Can I interject real quick?
Yeah, go ahead.
Thank you. So yeah, in both cases, if you stop life support, the person dies. So in this case, I'm just saying that if you're gonna, stop the life support, might as well, if it is less painful or whatever, to inject some opioids or whatever during that, rather than watch the body like just fail out of lack of nutrition or something. I think that's perhaps a little bit more humane. Also, I think the thing is called power of attorney, but I'm not sure.
Can I just jump in with a quick note? So anyone who did listen to this debate, please do go ahead and vote. If you go to general chat, you scroll up, you'll see 3 straw polls posted by Hermes. And, just vote sincerely however you think, only because we currently only have 3 people who responded. So it just doesn't give us much information. So if anyone else wants to vote, please do so. And then I'll let Drewish reply. And then there's something else I wanted to say.
Oh, okay. To your point, Hermes, I think that they're, sort of anticipating potential weaknesses in my own arguments here could be, for example, that like those opioids and things like that, like that. While there could be reasons there are reasons related or completely unrelated to suicide or the ability of one to painlessly commit suicide or as painlessly as possible commit suicide for potentially having these drugs not freely available. And so the notion of putting those access behind some kind of, wall could be made. But that argument, I think, considering what an opioid epidemic there is, in various places around the world, I don't really think that necessarily holds water there, because the people can't get access to them through illegal means. So what the hell you prevent us from having them through legal means? But to your other point, which was about, tell me if I'm mischaracterizing this though, the notion that you think that an individual, like a family member, like you have a sister. I'll just pick it, and you trust your sister and you love your sister, and you've got a debilitating disease. You've got Alzheimer's. You've been doing a lot with Alzheimer's, and you know that you're going to fade away, and you want to spend as much time as you can with people around you, knowing that at some point you're not really going to be there anymore, and you're not going to be able to recognize when you've crossed that point. But when you've gone past that point, you don't want to be around anymore. You want to get as much time as you can while still knowing that you won't be this burden to your family and that you will just forget everything about who you ever were. And so you want to then designate your sister to have the right to have you killed humanely, okay, per your wishes. Is that the kind of scenario am I reflecting what you're proposing accurately?
Yeah. But I would like to just add one more thing. If there is a scenario where a person doesn't have, any guardians or family, and, I know that's really rare, but if there really isn't anyone that's, caring enough, or like they're disconnected, like a lot of homeless people that just cut off from family or whatever, if they, I don't know, hit their head and all of a sudden they're brain dead. So the family thing, yes, definitely. But also, what if you don't have the family,
See, that's if there's any lesson to take away from the battle of assisted suicide, it's that doctors definitely have a God complex. Like you'd almost be more likely to convince me, or people who think like me, if you could make the case for, and you could designate anybody to be, your legal suicide enabler, as long as they weren't a physician, because it's the sort of thing where if you open it up, like there's a cost benefit to anything, right? We don't live in a utopian world. There are costs and benefits. And so you have to say, okay, how much suffering are we inducing upon this person by needing to then live out an extra 2 years in a nursing home or something, that they didn't want to have to live, okay, compared to the abuses which are occurring and well documented that necessarily would arise from that kind of agreement. Like it's one of those things where there can be situations where you're like, I really, in this situation, it makes sense. Is there any way to cross that line that doesn't also cross this? No, there isn't. That's the tough part. We have to be honest with ourselves about what those costs and benefits are. And then we can have a discussion. We can totally have a discussion, but we should not fool ourselves into thinking there's an ideal no-cost solution here,
I agree.
Please get in now, if that's okay. Thank you for your questions and that, but I'd like to take a turn as well. So first thing I wanted to just point out, we were talking earlier about, what is the definition of physician-assisted suicide? So this is the one essentially I've been using and would use as the first one that came up. Assisted suicide is generally defined as the act of intentionally killing oneself with the assistance of another person who provides knowledge, means, or both. So again, I think a lot of our debate there was kind of somewhat confused in a sense, because it seems to me, having heard you, that your idea of what physician-assisted suicide means had to essentially involve the doctor putting a needle or something equivalent into someone else and therefore killing them, and therefore that it isn't suicide. But as you can see, indeed, even if all the doctor does is provide a description to a person of how to kill themselves, like a printout sheet with step-by-step instructions, that's still physician-assisted suicide. Likewise, if a doctor simply provides the medication, the drug that kills the person, he gives them the means, that's still physician-assisted suicide. So it may be that part of our apparent disagreement there was actually not a real disagreement, because it may be that what I was advocating is actually totally amenable to you, which is a doctor goes in, gives a little printout and says, listen, this is phenobarbital, this is the pill, here's what's going to happen, here's the glass of water, if you're sure you want to do that, sign here, and I'll sit right here and I'll be here to help you if anything goes wrong. It seems to me, based on what you've said, that you don't actually have a problem with that, as long as the patient puts the pill in their own mouth. So then we do indeed have no disagreement, but it's actually you who's capitulated that you do actually support physician-assisted suicide. I'm not doing that to be like, haha, got you, but that is the fact.
Actually, I do disagree with that, because I feel like the medical establishment prevents people from getting care and access to things that they should have more freely accessible. In my ideal world, the physicians are never the ones putting the pills in people's mouths, but the pills don't need to be, you don't have to go to a physician to get the pills. And that would be a different debate, I guess. But it's the sort of thing where I do not want the medical establishment determining for me. I come from a place of self-ownership, and I know that there are other things. That's a whole other debate. But no, we would disagree for different reasons. Let me put it in that one.
So I think we've done this pretty good justice. I'm quite happy with the outcome of not the outcome of the votes, but the outcome of the event, the way that it went. I think that was a good covering of the subject. I'm confident that it gave everybody lots to think about. So I'm just going to go ahead and read the results of the polls now. So in the poll that says who did better at the debate, we have 60% have voted for Drewish as doing better, and 40% have voted for Shogun. That's a total of 5 votes, 3 for Drewish and 2 for myself. And then we'll go to the second question. Who did you agree with? Results. And in this case, we have 3 people agreeing with Shogun at 60% and 2 people agreeing with Drewish at 40%. And then the final question is, did listening to this debate change your mind? And we'll check the results of that. And we're going to say that yes, 3 people changed their mind and no, 2 people didn't. So that right there tells you that this was a very worthwhile debate, because although we cannot tell in which direction they changed their minds, 3 people had their minds changed on this opinion of this issue as a result of hearing this debate. That's why we do it, as well as for entertainment, education, information, and the sharpening of our skills. As the book of Ecclesiastes says, as iron sharpens iron, so one man sharpens another. So thank you for helping to sharpen my mind, sir. And to summarize, people thought you did better at the debate. More people agreed with me, but overall it was neck and neck and even in all regards. So thanks again, my friend. Do you have any closing remarks or thoughts before we wrap up the podcast?
No. I need to go get some water. I've talked quite a bit.
Thank you again, Drewish. That was great. I look forward to more debates with you, including hopefully an upcoming continuation of your debate with Hermes on God and formal logic that hopefully we can set up in the near future. Thanks again to the moderator, the audience, the recorders, and please check out all our great podcasts on #Roundtable Podcast, RT Podcast. We have YouTube and BitChute channels with hundreds of great episodes, all of them unique. So follow, subscribe, like all the channels, and keep an eye on announcements. We will be having a very important server meeting tomorrow at 9 p.m. Central. So we very much hope that you guys can attend that. It will be recorded and uploaded in case you miss it, but please attend. It's important that you be there in person if at all possible. Spread the word. And we're going to have another event coming up soon with myself being interviewed by Rafi on the subject of sociology, social science, and social theory. So that's going to be cool, and lots of other stuff too. Thanks a lot. And yeah, thanks, Drewish. I'll see you.
See you in the pub in 5 minutes for workout?
Yeah, that's right. We have to do, thank you for reminding me. So the Halloween workout challenge people have to work out. So let's jump to the pub and do our Halloween workout that we have to do until